Good afternoon. Welcome to the Kern County Emergency Medical Care Advisory Board meeting of November 14th. At this time, we'll refer to staff for the roll call.
Chairman Flores.
Here.
Sheriff Youngblood.
Here.
Peter Brandon. Orchel Cryer.
Here.
Scott Hurlbert.
Here.
Dr. Franklin.
Here.
Tyler Wetzel.
Here.
John Surface.
Here.
Dr. Lyon.
Here.
Leslie Wilmer. Here. And Chief Linville.
Here. Thank you.
We have a quorum.
Yep, thank you for that. That brings us to our salute to the flag. Sheriff Youngblood, would you please lead us in the flag salute?
Yes. Face the flag, place your hand over your heart. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. That brings us to the consent agenda. At this time, I'll read the paragraph. All items listed with a CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and then may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda and it will be considered in its listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. So we've all had time to review the consent agenda. At this time, I'll call for a motion.
Second.
Motion and second. All in favor?
Aye.
Opposed? Okay, motion carries. Thank you. That brings us to public presentations. Item 1. This portion of the meeting is reserved for persons to address the board on any matter, not on this agenda, but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask questions for clarification, make a referral to staff with factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name for the record before making any presentation. Is there any member of the public who would like to address the board? Okay. Seeing none, we'll move to item 2, board member announcements or reports. Okay, seeing none, that brings us to Emergency Medical Services Program request, and I'll turn this over to Mr. Ferris for item 3. Manager's report.
Yes, for the manager's report. Thank you, Mr. Chairman. Our EMS program continues to remain busy with improvements to the system, conducting quality improvement reviews, providing training to the public, continually reviewing policies, procedures, and protocols, and many other projects. Our training team has trained 235 individuals in the following: hands-only CPR, stop the bleed, water watchers, and Narcan administration. Our certification team completed 372 certifications and accreditations in the third quarter of this year. This includes EMTs, paramedics, emergency medical dispatchers, and mobile intensive care nurses. In January, EMS is hosting a mandatory update training for all paramedics working in our system. It will take 5 full days to get all 270 paramedics brought up to date on all the recent changes made to policies, procedures, and protocols. We have seen several large events this year, with several more fast approaching. In September, we oversaw Wasteland Weekend in North Edwards. This had an attendance of 3,500 people with 979 patients treated on site and 6 patients transported to local hospitals. On October 18th, EMS responded to an unsanctioned event located on South Edison Highway. EMS was notified of this event by Kern County Sheriff's Department. EMS staff responded and attempted to gain access for the purpose of evaluating the event for compliance with policy. However, we were refused access and were told that the event was on private property. It was noted that there were approximately 300 attendees that required a purchased ticket to enter. Kern County Sheriff were also refused access as well. It is because of events such as this one that EMS is moving towards converting our event policy to an ordinance. In the next year, we plan on bringing that before the Board of Supervisors to develop an ordinance that will give us a little more teeth when it comes to events such as this one. We need to be prepared for any emergencies that could occur from such an event. We will be seeing several events as we enter 2025, including Neotropolis in February in the East Kern with an expected attendance of 2,000 people. Boots in the Park in March at the Kaiser Sports Center with an estimated attendance of 10 to 12,000 people. And of course, our favorite, Lightning in a Bottle, scheduled for Memorial Day weekend at Lake Buena Vista with an expected attendance of 30,000 people. On October 9th, Kern County EMS, in partnership with Kern Behavioral Health and Recovery Services, hosted a First Responders Mental Health Symposium. As we know how the challenges first responders face with this industry, the Kern County Fair provided the venue for the event, which saw 91 attendees listen to 3 speakers talk about post-traumatic stress disorder and ways to deal with what we see in the field every day. The event also provided continuing education credits for our attendees and was such a success that we are already planning next year's event. In addition to all that, operations is currently working through the review of all policies to assure that they are up to date and appropriate. An internal QI subcommittee has been established as well. This will ensure our QI processes are committed to enhancing the quality of patient care through comprehensive evaluation methods and proactive initiatives on an ongoing basis. During the Burrell Fire, EMS staffed the Public Health DOC, pre-planned the evacuation of Kern Valley Hospital, and staged equipment in the Kernville area to assist with possible needs. The forethought in staging that equipment came in handy the next day when the fire camp required a very large generator and the hospital needed air scrubbers to assist with smoke in the area. Our emergency preparedness team has been extremely busy working with the region and here in Kern County with the H5N1 virus. In Kern County alone, the EP team has distributed 37,000 N95 masks, 25,000 gowns, 5,000 face shields, 1,000 pairs of goggles, 1,200 boxes of gloves, for a total of 69,200 pieces of PPE just to handle the H5N1 exposures that we currently have. EP is preparing to distribute $170,000 in grant funds to medical health facilities throughout our system to assist our partners to be better prepared for disasters. EP is working with the County Emergency Operations Center as it transitions to a Type 3 credentialed center. Once this transition is complete, only properly credentialed individuals will be permitted to have a seat in the EOC. EMS added to our numbers again by hiring a new EMS coordinator, Shahan Yamar. Shahan is a 20-year paramedic, former Marine with a BS degree in emergency management. Shahan has been a great addition to the EMS program, and we are very happy to have him aboard. This concludes my statement, my report, and I'm available to answer any questions. Thank you.
Thank you, Mr. Ferris, for that comprehensive report. Any questions or comments from the board? So, I think Mr. Surface might.
Just going to motion, receive, and file.
Okay. We have a motion to receive and file. Just need a second.
Second.
and a second. All in favor?
Aye.
Aye. Opposed? Okay, motion carries. Thank you, and that also brings us to APOT Task Force.
Thank you, Mr. Chairman. The quarterly APOT Task Force meeting was held on October 24th with representatives from Public Health, EMS, Kern County Fire, Hall and Liberty Ambulance Services, and Adventist Health and Dignity Health Hospitals. EMS gave our report, which included the total number of APOT hours. In the third quarter of 2024, APOT hours totaled 8,307, which represents an 18.6% increase from quarter two and a 36.6% increase from quarter one. All hospitals in our system are operating well above the acceptable greater than 30-minute offload expectation as outlined in AB 40. It appears that call volumes, staffing, transport volumes, the misuse of the 911 system, along with internal hospital systems, are continuing to play a role in the ongoing delays. Additionally, hospital staff continue to fail to use the patient offload bidirectional link that was provided to them by EMS. The APOT Task Force has been meeting for several years now and at the direction of MCAB with little to no results. We are actively changing several of our meetings in structure and schedule as we enter 2025. One of those meetings that we're changing is called the EMS System Collaborative Meeting. In this meeting, we invite members from every aspect of our system, including hospital, fire, law enforcement, behavioral health. It is a very large face-to-face meeting. We're going to have it twice a year. A lot of the same members of the APOT Task Force will be attending that meeting. At this time, I am requesting that the board approve the merging of the APOT Task Force with the EMS System Collaborative with a meeting schedule of twice a year. I believe this move would create a better forum for open discussion regarding offload times by opening it up to other members of our system for input. That concludes my report. It is recommended that this report be received and filed and that the APOT Task Force be merged with the System Collaborative meeting. And I'm available to answer any questions.
Okay, thank you, Mr. Ferris, for those sobering statistics, and hopefully we can reverse that trend, and I look forward to the merger. Any comments or questions?
So APOT's a big deal for all of us, and I kind of feel like we're waving the white flag now. And moving it to a bigger meeting that's not focused on APOT, I just think that we're waving the white flag. I sat through IMSA's workshop to try and implement the state issues, and the arguments are the same. It's the ambulance's fault, not the hospital's fault. And so the only reason I'm saying that now, I'm just going to go on record and tell you that it's not whose fault it is, right? It is not our fault. We're doing our part, right? And it infuriates me that we're sitting here again and we're going to pass the buck, right, collectively, right, because we can't get anywhere. I agree with you, we're not going to get anywhere with the system when the California Hospital Association tells stories about how it's our fault, and they want, they don't believe our electronic devices that are tracking. True statement. I mean, she told the story that our electronic devices aren't good enough to tell us what time our ambulance got at the hospital, and they were calling in on the radio on purpose early and saying we're there when we're still 5 miles down the road, and that's just not happening. So I'm kind of disappointed, but it's not unexpected.
Thank you. Thank you, Mr. Service. Yeah, and I personally, I don't view it as an ambulance issue either. I view it as a nurse staffing issue and hospital staffing issue fundamentally, but I think that going in this direction isn't this to strengthen and take on the issue and bring it down? Okay.
Can I comment? And again, I don't know if there's if you can identify fault. right? I mean, I don't think if you could identify fault, then the solution would be easy. You know, does nurse staffing maybe have a piece of it? You know, probably. Is there some aspects from the ambulances as well? Is there also just the fact that, you know, behavioral health is rampant and emergency rooms have been full of behavioral health patients, and our EMS providers also are full of behavioral health. And it's only going to get worse with some of the new initiatives that have passed within the state. SB 43 is something that we look at closely and are trying to determine what the impact of that's going to be once that's implemented, because in terms of emergency rooms, they're going to become a dumping ground for essentially anybody and everybody that you find on the street, which the capacity has not been built. So there's some significant capacity restrictions in the community. Now, Jeff, you had made the comment, I don't, you know, can you kind of expand on, you mentioned having other providers input by merging the APOT task force with the other meeting, how the other input is going to assist?
Member Weitzel, through the chair, the reality is I don't know how it could hurt, to tell you the truth. At this point, we're meeting quarterly. The meetings last 10 to 15 minutes. I give our reports. I ask for input from the hospitals, and I rarely get it. They sit quietly. I try and generate open discussion about how we can work on fixing the problem. And I mean, to be truthful with you, sir, it's really just a waste of time every quarter. That's why I'm trying to move it. Maybe if I change it, we can generate conversation, was my thought process for moving it to the larger meeting where there's, you know, more people that have a different perspective. Perhaps that can generate conversation.
Yeah, and I can understand that. I know we've had conversations in the past about the task force meetings and their effectiveness, and it's, you know, how do you make that effective? And, you know, could there be different strategies and approaches potentially? I mean, again, I'm not against it. I've, you know, sat in on a couple. You know, I understand what you're saying. I just don't know how increasing participation, because we're talking about a very defined issue, right? And you might get some people who throw out some ideas, but, you know, unless you're one of the, you know, hall ambulance workers who's in the emergency room with the patients, or the nurses who are in the room or in the emergency room, you really just don't understand really the workflow and what's going on. You know, it's a complex system in there. I think we're all aware of that.
Mr. Chair?
Yeah, sure.
So 2 days ago, we had 14 times where we handed off, or it's a new term, stacking patients.
Stacking.
You arrive at the hospital, there's nowhere to put them, so 3 or 4 ambulances will share their patient with one crew. They can go back on the road. That 14 times 2 days ago, 26 times yesterday. The same hospital where that's happening is now getting away of the policy that EMS issued, direct to triage. So the tools that we have, the hospitals that cause the biggest backlog won't let us use our tools. They belittle paramedics that try to use it, right? And we went through that yesterday at one of the hospitals. So I think there's a few tools that have been released, but the hospitals push back. So if you're really gonna fix the problem, it has to be the hospital leadership that's in the room, not the ED leadership, not the nurses, not paramedics. It needs to be the decision makers, and that's the hospital council. That's where the discussion should take place.
Okay, any other comments or questions?
Not for me.
Mr. Hurlbut?
Well, I might ask again, Chair, is there a possibility for a hybrid where maybe you keep the 2 meetings scheduled, but join one of the quarterly or 2 of the quarterly rather than collapsing them? To see if there's improvement?
That is a possibility. We are moving the system collaboratives to twice a year, so we could keep 2 virtuals and 2 face-to-face at the system collab and see if there's a change.
See if there's improvement. To further your statements. I was an unfortunate customer of these services this year with my whole family, and witnessed that the use or at least misuse of the emergency room services, and to the detriment of the folks that were there for legitimate reasons. So, I think we're all anxious for some improvement, if not a solution. So maybe that would help. Mr. Ferris,
Yeah, so I mean, I'm open to any, if you want to create a hybrid or sustain your recommendation, and Mr. Weitzel, thank you, there are multiple variables at play that cause this, it's not one in particular. But I think it is important that we have the right players in the room, and are the right players in the room in our current structure?
I do not believe so.
Okay, so I don't think we can force them, but can we lean on them to participate more fully? And maybe send a letter on behalf of the MCAB board or make some calls to the CEOs, because their absence is a problem.
So,
I agree.
You can get them to participate if you get the news media to do a story on what's occurring. With video, they'll be up front personally.
so
Sure, we did that,
I
sure.
wouldn't say that that's probably the best solution there. We're going to start
Me all the time. I go right to the table.
Yeah. You're going to start isolating. I think I was going to ask another question, if it's all right. And it might even be for Bryn. Bryn, I know that we, during the pandemic, you were gathering the hospital CEOs and just coordinating on a regular basis. Do those meetings still, I thought there was some kind of coordination meeting that you were still potentially running with the hospital CEOs. But, I mean, potentially expanding that, I don't think there's going to be pushback. A lot of it, though, is, again, what is the solution? Because, like John mentioned before, he feels like ambulance companies get all the blame. Hospitals feel like they get all the blame. I mean, everybody feels like they get all the blame, and they're trying to do what they can with the tools. It's just, you have any number of pressing priorities. Gladly, I'll walk any of you through our emergency room on any given day, and you can see just the elaborate processes that we have set up. And then it's all the way downstream as well. As we're trying to discharge patients from the hospital so that you can move patients from the emergency room up into the med-surg floors, you've got patients that you can't discharge. So, I mean, again, we're talking about a very complex problem. I don't think anybody's trying to blame anyone for, whose fault it is. It's just acknowledging that this is a large issue. There's not going to be a silver bullet, but again, it's getting the right people in the room to discuss.
So, point well taken. So given the complexities, and you close with getting the right people in the room, and since we don't have the right people in the room, how do we take that next step to ensure the right attendance and the right players so we can collaborate and work on solutions? Because those that are absent, that doesn't look good on them. To me, that seems like they're carrying the load there, and their absence speaks volumes.
Mr. Chairman, I think the next step would be, in my personal opinion, is to dissolve the current task force and work on creating a regular meeting. And I know that Bryn was asked a question about the CEOs. And by trying to create a regular meeting with the CEOs, which is, and I want to address something real quick, Member Weitzel through the chair. I know that at one point in time, a previous CEO from your hospital had it figured out. And that was the only hospital that had it figured out. And I don't know how he did it, but he did it. And so we know that it can be done. But I agree that the right people are not in the room. The people that are attending our meetings now have no input. They have no skin in the game, so to speak. It's basically they're not motivated to make any changes. And so we are going to have to, if we continue with this model that we're working with, it's just going to be the same continually. So I think we need to dissolve this task force and maybe create a new set of meetings or something with the CEOs, assuming they will attend. And I think, Bryn, did you want to address that?
during the pandemic, we did establish monthly meetings with our department and the hospital CEOs. They were well attended, and we had a common goal. So we were always talking about the pandemic and how to respond to the pandemic and resources that were needed or resources that were available. The topic of conversation did shift to APOT with the hospital CEOs. They're aware of the task force. They have delegated the responsibility to, most of them have the ED managers that are attending. I know there was one CEO in the last APOT task force meeting that did attend. But I am happy to ask all of the CEOs to regroup and have another discussion on the topic and ask if they will attend on an ongoing basis to continue the discussion to see if there's anything that can happen.
Okay, thank you. I think that's, to me, that sounds, as one member, it sounds as like a reasonable approach. So maybe we disband, we forego the merger at this point and come back with maybe something new, more effective, with the right people in the room. I'm fine with that as one member. If anyone else wants to weigh in.
I think it's important that they know it's not an accusatory meeting, it's a collaborative meeting for working towards a solution for all of us.
Yeah, yeah, it's for everybody. Thank you, Sheriff.
So, Mr. Chairman, may I ask for point of clarification, exactly what is it that the board is requesting from me?
So I'll just throw out a starting motion that we disband the current task force that has been ineffective, not for lack of trying, but it's not working, that we forego the merger because Mr. Serpis brought up some issues that might just be a 2.0 of ineffectiveness, come back with a third option, bring it back to our board about reaching out in a collaborative, positive way with the right people that can make the decisions and have good ideas and come back and create a new committee or meeting structure.
Understood, thank you.
And, Mr. Chair, for the record, Kern Medical has the best offload times in Metro Bakersfield.
Thank you. Good. Thank you for that comment. Okay, so motion and second, all in favor? Aye.
Aye.
Okay, opposed? Okay, motion carries. Okay, thank you for that discussion and comments. That brings us to adjournment. The deadline for submitting public requests for the next MCAT meeting is Thursday, January 30th, 2025 at 5 p.m. to the EMS program manager. And we'll adjourn to Thursday, February 13th, 2025 at 4 p.m. Here in the same building, the Kern County Board of Supervisors Chamber at 1115 Truxton Avenue. At this time, we'll adjourn. I just need a motion. And then a second? Second, okay. We're adjourned.